Hello, welcome back to Not Fake News. I'm your host, Commander Cody. We have now two related stories, both brought to you by National Public Radio, both broadcast recently. The first is called Insulin's High Cost Leads to Lethal Rationing. The date is September 1st, 2018, as heard on Weekend Edition Saturday. Story by Bram Sable-Smith. Diabetic ketoacidosis is a terrible way to die. It's what happens when you don't have enough insulin. Your blood sugar gets so high that your blood becomes highly acidic. Your cells dehydrate and your body stops functioning. Diabetic ketoacidosis is how Nicole Smith Holt lost her son 3 days before his payday because he couldn't afford his insulin. Quote, It shouldn't have happened, unquote, Smith Holt says, looking at her son's death certificate on her dining room table in Richfield, Minnesota. That cause of death of diabetic ketoacidosis should never have happened. The price of insulin in the United States has more than doubled since 2012. That has put the life-saving hormone out of reach of some people with diabetes, like Smith Holt's son, Alec Rayshon Smith. It has left others scrambling for solutions to afford the one thing they need to live. I'm one of those scrambling. Most people's bodies create insulin, which regulates the amount of sugar in the blood. In the U.S., roughly 1.25 million of us with type 1 diabetes have to buy insulin at a pharmacy because our pancreases stopped producing it. My first vial of insulin cost $24.56 in 2011 after insurance. 7 years later, I pay more than $80. And that's nothing compared with what Alec was up against when he turned 26 and aged off of his mother's insurance plan. Smith Holt says she and Alec started reviewing his options in February 2017, 3 months before his birthday on May 20th. Alec's pharmacist told him his diabetes supplies would cost $1,300 a month without insurance, most of that for insulin. His options with insurance weren't much better. Alec's yearly salary as a restaurant manager was about $35,000. Too high to qualify for Medicaid and, Smith Holt says, too high to qualify for subsidies in Minnesota's health insurance marketplace. The plan they found had a $450 premium each month and an annual deductible of $7,600. Quote, At first he didn't realize what a deductible was, unquote, Smith Holt says. She says Alec figured he could pick up a part-time job to help cover the $450 per month. Then Smith Holt explained it. Quote, You have to pay the $7,600 out of pocket before your insurance is even going to kick in, she remembers telling him. Alec decided going uninsured would be more manageable. Although there might have been cheaper alternatives for his insulin supply that Alec could have worked out with his doctor, he never made it that far. He died less than 1 month after going off of his mother's insurance. His family thinks he was rationing his insulin, using less than he needed, to try to make it last until he could afford to buy more. He died alone in his apartment 3 days before payday. The insulin pen he used to give himself shots was empty. And now a related story, this one entitled, Analysts Predict Healthcare Marketplace Premiums Will Stabilize in 2019. As heard on Morning Edition, September 3rd, 2018, Allison Kojak reporting. Consumers who buy insurance through the Affordable Care Act markets may be pleasantly surprised this fall as average premiums are forecast to rise much less than in recent years. The price of a 2019 policy sold on the ACA exchanges will increase less than 4%, according to an analysis of preliminary filings from insurers in all 50 states by acasignups.net, a website and blog run by analyst Charles Gaba that tracks ACA enrollment and insurer participation. And those insurers are expanding their offerings. Quote, The news about the marketplace this year is very good, both in terms of the premium increase and the extent of carrier participation, unquote, says Catherine Hempstead, a senior policy advisor at the Robert Wood Johnson Foundation. Note, the foundation supports NPR's healthcare coverage. She says premiums overall are rising at about the same rates as medical inflation, which is a big change from the last few years when prices rose in the double digits. For example, the cost of a bronze policy, which is intended to cover about 60% of a person's healthcare costs, rose 17% from 2017 to 2018, and the cost of the more popular and more generous silver plan rose 32% in the same time frame. Quote, "We're seeing that double-digit kinds of increases are occurring in a small handful of states, but they're definitely the exceptions," unquote, says Hempstead. For example, premium prices in Kentucky and Connecticut are both forecast to rise an average of 12%, according to ACAsignups.net. Quote, "In quite a few states, we're actually seeing premiums going down," unquote, she says. In New Hampshire, prices are expected to fall about 13%, and in Tennessee, they could drop 11%, according to the analysis. Insurance companies are also expanding into new markets, says Hempstead, who has been tracking what policies companies plan to offer in various counties. In Pennsylvania, 4 companies, Geisinger, UPMC, Capital Blue Cross, and Highmark, are expanding their coverage footprints. The upstart health insurer, Oscar, which got into the insurance business specifically to serve ACA markets, is expanding to Florida, Michigan, and Arizona. The Wellmark, which abandoned the ACA in Iowa last year, is returning. Hempstead says the increased offerings are a sign that the market is maturing. Quote, "After a very tortured birth and infancy, it seems like the markets in some ways are at a very stable place right now," unquote, she says. She says insurance companies have figured out how to make a profit from the policies they sell on the ACA exchanges. But the news could be better, Gaba says. Premiums would actually be falling next year but for the actions of the Trump administration and Republicans in Congress that have weakened the ACA law itself and its markets, Gaba says. Those actions include getting rid of the tax penalty for people who don't buy health insurance, refusing to reimburse insurance companies for discounts that are required by law to be offered to low-income customers, and encouraging insurers to sell stripped-down short-term insurance. Those moves are draining healthy young people out of the ACA market. Quote, "The reality is that if you didn't have those factors, if you didn't have the expansion of short-term plans, and especially the repeal of the mandate penalty for next year, average premiums would most likely be dropping by a good 4 or 5%, unquote, he says. Gaba says some states have managed to lower their premiums by adding a state-level individual mandate, requiring people to buy health insurance, or implementing a reinsurance plan that limits the amount of high-priced medical care an insurer will have to pay for. Whether premiums go up and down, consumers who qualify for a subsidy will likely pay about the same for their insurance next year as they're paying now. Subsidies are available to people who earn less than 400% of the federal poverty level, which is $24,600 for a family of 4 this year. Open enrollment for 2019 on the federal exchange and in most states begins on November 1st this year. And that's all for this edition of Not Fake News. Thanks for listening.